بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My short talk today is about cerebral edema or brain edema. It is not a disease entity, it is a clinical pathological state that characterized by an increase in brain water content above the normal brain content in about 80%. It usually occurs in response to brain insult, which is seen in a variety of neurological and non-neurological conditions. Cerebral edema causes increases in brain volume, and because brain is confined within a rigid skull, it increase in the brain water content ultimately result in increase in intracranial pressure, and this increase in intracranial pressure decrease cerebral perfusion and leading to cerebral ischemia. And in addition, cerebral edema may result in brain herniation due to associated mass effect and ultimately death. What are the classification of cerebral or brain edema? Can be classified into vasogenic edema, cytotoxic edema, interstitial edema, osmotic, and hydrostatic edema. I will discuss here in this short talk the cytotoxic edema, vasogenic edema, and interstitial edema. Here, these are the types of the cerebral edema. Cytotoxic edema represent intracellular water accumulation. It is intracellular water accumulation due to failure of potassium and sodium pump. Here, the blood-brain barrier is intact and usually responds to ischemia or hypoxia, and both gray and white matter are affected because it is supplied by a blocked vessel in the infarcted area, also seen in the infarction, or as we said, or hypoxia, and maximum edema is usually within 48 to 72 hours. Vasogenic edema, it is a result from increased permeability of the capillary endothelial cell. Here we see there is disturbance of the blood-brain barrier due to injury, and this will lead to leakage of fluid and protein from intravascular to extracellular space, and the white matter here is affected, and it is seen in the trauma, tumor, focal inflammation, and late stage of cerebral ischemia. As we said, it is in cytotoxic edema, it is intracellular, the cells are swollen, and the vasogenic edema, it is extracellular, and it is in a fluid into interstitial space from the intravascular to extracellular space, and here blood-brain barrier is intact, and here blood-brain barrier it is disturbed and leading to leakage of fluid to interstitial space. In cytotoxic edema, it is involved the gray and white matter, as we see here in this infarction patient, and there is loss of gray and white matter interface. And in the vasogenic edema, it is confined to white matter with finger-like projection extended in the subcortical white matter and spray the cortical gray matter. Gray-white matter interface is pronounced instead of loss. Here, pronounced gray-white matter interface, and here it is lost the gray-white matter interface in cytotoxic edema. Interstitial edema, it is a result from acute obstruction of the ventricles, CSF in the ventricles, acute obstructive hydrocephalus, and CSF pushed into extracellular space in the extracellular space of the periventricular white matter in hydrocephalus. What is the imaging of the brain edema? The rule of imaging it is to confirm the presence of edema or not and determine if there is any underlying cause and determine whether there is sequelae from the mass effect or not. The radiological features, compression and displacement of the adjacent structure, and there is changes in the parenchymal density in the CT scan and signal MRI. In the CT scan, it is appear hypodense area. In the T2 and the FLAIR images appear hyper intense, and in the T1 weighted images appear low intense area, low signal intense area, and diffusion imaging is the most sensitive to detect intracellular cytotoxic edema with a bright signal, and also contrast help to delineate the lesion within the surrounding edema. Let us see some examples. Here, patient with middle cerebral artery infarction, and there is loss of the gray-white matter junction, and the edema it is causing it is cytotoxic edema causing mass effect on the right lateral ventricle. And in another patient, there is loss of cortical sulci in this patient as compared to the left side due to edema. Another patient, middle cerebral artery infarction with mass effect on the left lateral ventricle, and the edema involved the gray and white matter as we see in this example. Here, this is the diffusion imaging. As we said, the diffusion it is very sensitive to intracellular cytotoxic edema from acute infarction, and in this patient, MRI T1 show ill-defined hypo-intense area, and the diffusion it is delineate the acute infarction in the territory of the middle cerebral artery. Here, this is patient with vasogenic edema, and we see abscess here in the occipital region, and this is the edema. As we see, it is finger-like projection with involving the white matter and disperse the gray matter. Here, another patient with metastasis from the breast, and we see the edema as finger-like projection, and the contrast study denied the mass in this area, obliterating the trigone of the right lateral ventricle, and also there is mass effect on the right lateral ventricle here. Here, patient with interstitial edema, as we see hydrocephalus and hypodensities involving the frontal and the occipital horns of the lateral ventricle. Here, another patient with medulloblastoma, mass in the posterior fossa causing obstructive hydrocephalus, and we see the edema as hyperintense area around the lateral ventricles. Here we see extracellular edema due to diffuse brain edema with absence of the sulci, and poor differentiation between grey and white matter due to the causes of in these cases like trauma, anoxia, infection, syndromes from inappropriate antidiuretic hormones, and high altitude. In general, cerebral edema, it is a pathologic increase in the water content of the brain and increase in the cranial pressure and lead to neurologic deterioration, herniation, and death, as we said in the introduction. In summary, we have cytotoxic edema and vasogenic edema. Cytotoxic edema involves the gray and white matter junction. Blood-brain barrier is intact. Best example is infarction. Vasogenic edema, it is involve the white matter, and it is due to mass effect or abscess or infection, and it is interstitial edema, and it is involved, as we said, the white matter. The gray matter is not involved, and the blood-brain barrier is not intact. As we said, CT hypodense area, MRI T1 hypointense area, and T2 and flare and diffusion hyperintense area. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.